Oh, great. This doesn't. Hold on, folks. Give me this. Okay. Good afternoon, folks. Today's topic is, for A, is Geoscience, Rethinking How Medicine Can Approach Aging. So we're going to discuss that for A this afternoon. Here we go. Geoscience, Rethinking How Medicine Can Approach Aging, explores a transformative shift in medical strategy focused on aging itself rather than individual diseases. Here are some key points. The main concept: geoscience is an emerging field that targets the biological processes of aging to prevent or delay multiple chronic diseases simultaneously. This approach aims to extend health span, the number of years people live free from disease and disability. Expert insights. The review was co-authored by Dr. Stephen R. Cummings and led by Dr. Stephen B. Kurczewski, published in JAMA. They argue that treating aging as a root cause could be more effective than the traditional disease by disease method or model. Urgency and impact. By 2050, the U.S. population over 65 is expected to increase by more than 30 million. Without a shift in strategy, the healthcare system may become overwhelmed. Geoscience could offer a scalable solution to improve longevity and reduce the burden of age-related diseases. Would you like to explore how this approach could be adapted for culturally responsive aging interventions or integrated into hold on 1 second. Geoscience has profound implications for public health, especially as populations age rapidly. Here is a breakdown of its potential impact. Public health implications of geoscience: shift from disease management to prevention. Traditional medicine treats chronic diseases individually, e.g., heart disease and diabetes. Geoscience targets the biological aging process itself, aiming to delay or prevent multiple diseases simultaneously. This could reduce overall disease burden and improve population health outcomes. Extension of health span focuses on increasing the number of years people live free from disease and disability, not just lifespan. Promotes functional independence, reducing long-term care needs and enhancing quality of life. Healthcare system sustainability. By 2050, the US population over 65 will grow over 30 million. Without a new approach, the healthcare system may become overwhelmed. Geoscience offers a scalable strategy to manage age-related health changes more efficiently. Equity and access. If implemented thoughtfully, geoscience could help reduce disparities in aging outcomes by addressing root biological vulnerabilities. It opens opportunities for culturally responsive interventions tailored to diverse aging populations. Policy and resource allocation encourages reorientation of public health policy toward aging biology and research to preventative care. Could influence funding priorities, workforce training, and infrastructure development for elder care. Would you like to explore how geoscience could be integrated into community-based programs or adapted for marginalized aging populations? Caregiver toolkits. Geoscience can significantly improve chronic disease management by addressing aging as a root cause of many conditions. Here's how. Transformative impact on chronic disease management, unidentified prevention strategies. Instead of treating disease like heart disease, diabetes, and cancer separately, geoscience targets the biological aging process that underlie all of them. This could delay or prevent multiple chronic conditions simultaneously, streamlining care and reducing polypharmacy. Improved health span. By slowing aging, geoscience promotes functional independence and reduces the need for long-term care. Patients could remain healthier for longer with fewer hospitalizations and complications. Reduced healthcare burden. With the US population over 65 projected to grow by 30 million by 2050, managing chronic diseases individually is unsustainable. Geoscience offers a scalable solution to reduce strain on healthcare systems and improve resource allocation. Personalized and culturally responsive care. Geoscience opens a door for tailored interventions that consider genetic, lifestyle, and cultural factors influencing aging. This can enhance quality, equity in chronic disease outcomes across diverse populations. Policy and practice integration. Okay. Encourages a shift in public health policy toward preventative aging, research influencing funding, training, and infrastructure. Could lead to new clinical guidelines that integrate aging biology into chronic disease protocols. Would you like to co-design a framework that integrates geoscience into caregiver toolkits or community-based chronic disease programs? Research supporting the effectiveness of geoscience is growing rapidly with several key studies. An expert review highlighting its potential. Here's a summary of the most compelling evidence. Key research supporting geoscience. JAMA review by Karchevsky and Cummings. A landmark review published in JAMA by Dr. Stephen B. Karchevsky and Dr. Stephen R. Cummings, advocates for targeting the biology of aging rather than treating diseases individually. It emphasizes showing aging could delay or prevent multiple chronic diseases simultaneously, improving health span and reducing health care burden. Biological mechanisms of aging. Geoscience research focuses on pathways like cellular since science okay, let's go this way. Inflammation, mitochondrial dysfunction, and genomic instability. Interventions targeting these mechanisms, such as sensolytics, chronic resection, um, min, matrix and mTOR inhibitors have shown promise in animal models and early human trials. Clinical trials and translational research. Studies are underway to test geoscience based therapies in humans, including trials on metformin and rapamycin and analogs and NAD precursor. These interventions aim to improve resilience, reduce multimorbidity, and enhance recovery from illness in older adults. Public health policy integration. Geoscience is influencing public health policy by encouraging preventative aging research, reshaping clinical guidelines, and informing infrastructure investments. It supports personalized and culturally responsive care, enhancing quality in chronic disease outcomes across diverse populations. Would you like to explore how these findings could translate into community based programs or adapted for caregiver training modules? Geoscience has far reaching implications for public health, particularly as aging population grow and chronic disease become more prevalent. Here's a synthesis of key impacts based on the sources. Public health implications of geoscience. Preventative aging research. Geoscience promotes a shift from treating individuals' diseases to targeting the biological processes of aging. This approach could delay or prevent multiple chronic conditions simultaneously, reducing disease burden and healthcare costs. Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a bit to put that together for you, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.